Okay, well, today's the second day. Yesterday we talked about 3 important topics. Proper nutrition, which I think is essential. Food is our best medicine. If we don't have those building blocks, our body is not going to heal. Number 2, we talked about hydration, how important hydration is to eliminate toxins from your body. And also, hydration is important just for every cellular reaction in the body. It's also important because you're doing microcurrent. You want that current to flow more readily into your body. And the third thing we talked about was reducing stress, getting your body to relax. So those three things are essential. If you don't do those 3 things, then all these other therapies that we're going to talk about may have little or no effect. So I'd like to begin by talking about homeopathy. And maybe some of you have heard the word homeopathy, and most people have a lot of misconceptions about homeopathy. Homeopathy, it's easier to explain what it is not than what it is. Homeopathy is not diet, nutrition. It's not herbal medicine. It's not exercise. It's actually a specific way of approaching disease. Homeopathy is the only treatment that actually makes an attempt to cure disease. Every other therapy that's done by modern medicine, and there may be some exceptions, is mainly maintaining disease. And I'm referring to chronic disease. Obviously, if you break your arm, you need surgery. That's an acute problem, or if you have an acute appendicitis. But the majority of chronic conditions, modern medicine maintains it. They give you a prescription, take it. How long do I have to take the medicine for high blood pressure? The rest of your life. And chances are you'll need a second prescription, maybe a third. Same thing with glaucoma. You start out with 1 drop, 2nd drop, surgery. There's no attempt to cure the disease. So that's the big difference. Homeopathy actually makes an attempt to cure the disease. The second thing is that homeopathy believes that the body has a wisdom. If you believe that we are made in the likeness of God, our body has a wisdom. So every time we get a symptom or a disease, it's because we need that symptom or disease. Now, you may be kind of confused and say, well, why does my body need glaucoma? Why does it need macular degeneration? Well, the symptoms and diseases are necessary for us to maintain homeostasis or balance. So let me give you an example. If someone develops a fever, your body needs the fever. That's a simple explanation. Maybe you have a cold or flu. You need that elevated temperature to get rid of the toxins, to fight the infection. If you have diarrhea, there's a reason why you get diarrhea. Maybe you ate some bad food, you have an infection. Your body has a wisdom. So traditional medicine does not feel that the body has a wisdom. It feels that the body is like a machine or a car. If it's not working, you replace the part or you treat with opposites. So if you have a fever, the traditional doctor gives you something to lower your temperature, right? If you have diarrhea, the traditional doctor gives you something to cause constipation. If you have high blood pressure, they give you something to lower your blood pressure. So it treats with opposites, if you will. Same thing with glaucoma. You have glaucoma, your pressure is high, they give you a drop to lower it. You have wet macular, they give you do something to make it dry. They treat with opposites. Now the homeopathic doctor has a different approach. If the body has a wisdom, let's help the body do what it's trying to do. So if you have diarrhea, we give you a homeopathic remedy which causes diarrhea. Now you may be thinking, now wait a minute, Dr. Kondrot, I get diarrhea. I'm not going to take something to cause it. Wouldn't that make it worse? But interestingly, if your body has a wisdom and it's trying to do something, let's help the body. So when I was cured of my adult onset asthma, which was a scary situation for me, I was given a homeopathic remedy which caused asthma, which causes asthma. The traditional doctor gave me various medications like steroids, Theodore, Proventil. I was walking around with 3 different medications and still I almost died twice. They were maintaining my asthma. They weren't trying to cure it, but I knew in my heart that there had to be a cure. So I consulted some of the top traditional asthma specialists in the country, and they all told me the same thing. There's no cure, and make sure you take your medicine. If you don't take your medicine, I don't want you as a patient. You've heard that before. So I began to explore homeopathy because I had read some things about homeopathy, and I thought, well, why not? And if there was ever going to be a placebo effect, it should have been when I was prescribed my first homeopathic remedy, because I was really excited. I thought it was going to cure me. But the remedy did not do a thing, nothing. So I went back to the doctor, gave me a second remedy, and the second remedy may have helped. But the third remedy I got, it was unbelievable, like somebody turned a light on. My asthma went away, my mood and emotional state, and I said, by golly, this is a miracle. And so then I became really impassioned about studying homeopathy. I was living in Pennsylvania at the time, and I signed up for a homeopathic program in Berkeley, California. And every month I flew out to Berkeley for a long weekend, 4-day weekend, studying homeopathy, went back to Pennsylvania, did homework and studies, and went back. I did that for 4 years, and I got my homeopathic degree. But I can remember getting on the airplane in Pittsburgh, flying to San Francisco, and I was just so excited. I said to myself, this is true medicine. This is what, God wanted me to do, to use homeopathy to really cure people. And it just opened up my whole world. I was never so excited. And of course, at that time, I was a very busy, successful surgeon, and I did not give up my surgical practice. I was still doing surgery, but for patients that came in for problems that they were not getting better, I asked them if they would want to consider homeopathy. And I can remember one of the first really tough cases that I treated was a medical doctor, Indian medical doctor from the University of Tulane, who was lecturing in Pittsburgh, and he suddenly developed blindness in his left eye. Total blindness. Midnight in a coal mine. He had a stroke in his eye. And he went to the retinal center at the University of Pittsburgh. They diagnosed a central retinal artery occlusion. They said nothing can be done. They put him on a blood thinner so it wouldn't happen in the other eye. And he happened to find out that I was his homeopathic eye doctor. And in India, homeopathy is really, really big. It is well accepted. There's a joke that if you throw a stone into a crowd of people in India, you'll hit 5 homeopathic doctors. It's like every other person's a homeopathic doctor. But some of the best homeopaths are from India. And during the course of my training, I traveled to India many times and studied with 3 of the top homeopathic doctors, actually lived in their home for a while studying homeopathy. So I sat down with him, and you're going to find out that the homeopathic consultation was a little bit different. A homeopathic doctor treats the person, not so much the disease. We treat the person that has the disease. We don't treat the disease in the person. So if I treat 100 people with macular degeneration, each one will get a different homeopathic remedy because we're all different. I'm looking at all of you in this room, and you're all different. You may have all, the same eye problem, but you're different. You're dressed differently. You're sitting differently. His arms are crossed. You're holding your chin here. Your legs are folded. We're different. And homeopathy treats the individuality. Traditional medicine doesn't look at the individuality. There's the drug du jour. You have high blood pressure, everybody gets the same drug. Doesn't work, you get a second drug. They don't treat you as an individual. So in homeopathy, we treat the nuances, or the subtleties about your disease. How is it affecting you? What was going on when you developed? What are your fears and phobias? Other symptoms that you may have. And of course, the traditional eye doctor doesn't care about that. You know, I think right now the average medical doctor will actually really spend about 30 seconds with you. And they already have made up their mind what the treatment is. But a homeopathic doctor, I'm going to have to spend an hour with you before I know a good remedy. And we want to find out these details. So when I sat down with Dr. Dada, I wanted to find out more about him as a person. I knew he was the medical doctor who had a stroke in his eye. I wasn't like your traditional medical doctor. Well, stroke in the eye, you get this medicine, that's it. So I sat down talking with him. And very quickly I found out that he told me he likes to argue. He says, Dr. Kondrot, I love to argue. Even if I know I'm wrong, I'll just wear the other person down until they admit I'm right. And of course, at that point, I didn't want to get into an argument with him. And then, you know, we talked about other things, why he went into medicine, what his childhood was like, his favorite foods, his temperatures. But one thing in homeopathy, it's the causative factor. What was going on when you developed X? And so he told me, it's interesting. I lost an argument to my wife. Now, a traditional eye doctor would say, that has nothing to do with going blind in the eye. But a homeopathic doctor, that's everything. That's the case. You know, he loves to argue. It's his passion. He lost an argument to his wife and he went blind. Simple. Case closed. So I was really excited. But the bottom line is, does homeopathy work? So I said, Dr. Dada, you know, I don't have any experience in treating this, but I took your case. This is a remedy I think may help. So I gave him the homeopathic remedy, and I said, let's get in touch with in a week or so and see how you're doing. So I called him up in a week, and he said, Dr. Kondrot, wonderful remedy, completely normal now, completely normal, my vision completely normal. And I was like shocked. And he said something to me that I remember to this day. He says, Dr. Kondrot, you act surprised. What did you expect with homeopathy? What did you expect? So sometimes we have, our minds limit us, that we're trained that there's no cure, it can't be helped. But I don't know if any of you read the book or heard of the series called A Course in Miracles. In A Course in Miracles, they say that there's no difference between treating a headache and advanced cancer. There's no difference. You know, the body has the ability to heal. And so I love homeopathy because homeopathy acts as a catalyst to stimulate the body to heal. Put the body back into balance. Because when we do have a disease, number one, it's necessary for our body to have homeostasis. Now you may say to yourself, well, why am I getting inflammation in my eye? Why am I getting glaucoma or macular degeneration? Well, for some reason, your body needs it. I don't really have to understand why your body needs it. I just have to listen to your symptoms, the emotional state. I put it all together and select a homeopathic remedy. The other thing I like about homeopathy, we just don't treat one physical problem. Typically we treat, if you come to me and you have diarrhea, you have an aggravation with sugar, you have glaucoma, you got arthritis, you got dry eyes, your whole list of symptoms, one homeopathic remedy will treat everything. You know, traditional medicine, you go to the ophthalmologist, he gives you these drops, you go to the gastroenterologist, he gives you this, the dermatologist, the rheumatologist. Everybody treats that little part of you, but no one is treating you. So homeopathy treats you. And when we get the right remedy, It is amazing. The only problem is homeopathy is not easy. I've been studying homeopathy for close to 20 years, and I probably know less now than I did after I took my first course. But homeopathy does work. So I have a question for you. Who was the first homeopathic doctor? Hahnemann. Wrong. It was Moses. Corinthians, I don't know the verse and chapter, but he took the calf that they had made, he ground it, burnt it, put it in water, and made the children of Israel drink it. That's how we make our homeopathic remedies. We grind it, we burn it, we put it in water, and make you drink it. So Moses made the homeopathic remedy in the right way. Also, he selected the right remedy, because gold, the homeopathic remedy gold, is used for depression and despair. So he had selected the right remedy, made it the right remedy. So, but Hahnemann was the one that actually developed the current.
Yeah, because Moses can be also be considered as a legendary. You know,
So, when we do your homeopathic interview, we're analyzing your emotional state, your fears, causative factors, all your symptoms. We look at all these things and we select a homeopathic remedy. Now, something interesting in homeopathy is the way the body heals. The body heals from inside outward. So sometimes you get a homeopathic remedy, you'll develop a rash. When I did my homeopathic remedy, if you develop a rash after you take your homeopathic remedy, that's a reason to celebrate, because your body is healing inside outward. Also, the body tends to heal from above to below. By that I mean the mental, emotional symptoms are first, then the physical. So let's say I give you a remedy, and a month from now you say, unbelievable remedy. After I took the remedy, my vision is so clear, but I can't sleep at night, I'm irritable, I'm quick to anger. That's not a good remedy, because the physicals got better, but the mental and emotionals got worse. That's a bad remedy. But on the other hand, if you get a remedy and go, well, Dr. Kondrot, I'm not sure if my vision's better, but it's strange, I'm calmer now, I have more energy, I'm sleeping better at night, that's a good remedy, because the physicals will come after the mental emotional. And most diseases begin in the mental emotional body, then the physical. So we look at changes in rather see changes in the mental emotional. I have another case I want to share with you. This was an engineer that I treated. No offense, Tim. But this guy was your classic engineer. The pocket protector, 20 pens, the NASA glasses, the NASA haircut. He'd come in, he had a notebook, and he had glaucoma, and he was marking down the time he took his eye drop, the time he ate, the time I took the pressure, phases of the moon, all this stuff. He had all the logarithms and graphs of everything, trying to understand it like an engineer would. And of course, every time he came in, he had his notebook, taking notes, I'm checking his pressure, but he wasn't doing well. He was on 3 eye drops. And I said, Mr. Smith, I said, you're not doing well on eye drops. The next step is we've got to do surgery. Your pressure's too high, and you need surgery to get and he wasn't too happy about the surgery. But I said, I'm beginning to study homeopathy. If you like, we can do a homeopathic evaluation to see if that would help. So he agreed. Sat down and took his case, asked him all the questions I'm going to be asking you, and took my notes. I thought I had a good remedy. I said, here's the remedy. Let me see you in a month. We'll make the final decision. So I went into the office that day. I didn't know he was on the schedule, but the girls in the office said, Dr. Kondrot, Mr. Smith is here, but we didn't recognize him. So I was really eager to go into the room. So I walked into the room, and he had a sweater on. His hair was a little bit longer. He had blue jeans. And the first thing I said to him, I noticed he didn't have his notebook. So I shook his hand and says, "Hi, Mr. Smith, how are things?" I said, "Have you noticed any changes since you took the homeopathic remedy?" He said, "Nope, not a damn thing. Didn't do anything for me." But I said, where's your notebook? And you're dressed differently. Well, I decided, to change my style and all this. And his pressure was much lower. We got him off a couple of drops. We eliminated the need for surgery. We didn't eliminate all his drops, but he did so much better. So sometimes the changes are so profound, you don't notice them. And it's hard to explain because there's a general belief that disease comes from outside of us. We blame things on external circumstances. This person did this, the stress. But all our disease and problems come from inside. We project our reality. So if we change inside, the world changes. So I remember talking to this one guy after his homeopathic remedy. "Yeah, it didn't do much for me, Dr. Kondrot, but my wife isn't irritating me as much." So he thinks he didn't change, but the world is changing. You know what I mean? So, if you're an angry person, you tend to meet people that are angry, right? If you're happy-go-lucky, you tend to meet happy-go-lucky people. So homeopathy kind of changes the internal vibration of your body. It's a completely different way of looking at disease. And so all of you will be getting a homeopathic remedy, and we're going to be working with you over the next year. We may have to make some changes. Remember, it took me 3 remedies before I got my final one. Sometimes I hit it right on the hit. There's a profound change and people get better. Other times there's very little. So the staff is going to be going over how to take your homeopathic remedy, and we'll be getting in touch with you in a month, and you'll tell us any changes, if any. And of course, if you do notice a negative change, we want to hear from you immediately. Something peculiar happens. It may be minor to you, like for example, you take a homeopathic remedy and develop a wart that you never had before. I want to hear about it, because that could point us to a different remedy. Sometimes I don't get the right remedy. And I usually tell patients, if I don't get the right remedy after 3 remedies, go to somebody else. I may not be able to perceive the problem. That's why I like you folks being here for 4 days. I get to kind of know what you're really like. If you would just come in here for an hour, you may have a fake smile, and have certain mannerisms. But you being here for 4 days, you start to relax, and we get to find out your true nature. Your true nature. But I was involved with the homeopathic study looking at fibromyalgia. This was done at the University of Arizona, and it was done with 2 homeopaths. So it was an interesting study. We both took the case. We both had to agree on the remedy. Then the patient was prescribed the remedy, but we didn't know if it was the real remedy or a placebo, and the patient didn't know. The patient came back in 1 month, and we had to decide whether to change to the other arm of the study. So it was very, very interesting, but the study got positive results. But unfortunately, with homeopathic studies, you can't really do them in the traditional controlled study. You can't. It's a whole different paradigm of medicine. And we have a video here called Just One Drop, which the Australian Medical Society castrated the homeopathy. They want to get rid of homeopathy. And here in the United States, the FDA wants to get rid of homeopathy. Simply because modern medicine doesn't want any interference. And I believe that homeopathy should be the primary treatment of all our diseases. Now you may think, oh, well and good, Dr. Kondrot, it doesn't work for serious problems. But I'll tell you, every major epidemic in the world has been successfully treated with homeopathy. You may be shocked to hear that. The Spanish influenza epidemic in the early 1900s, the mortality was over 60% overall. The mortality under homeopathic remedy was less than 2%. And you may be saying, well, it really wasn't a good study. It's not like Dr. Kondrot reporting on 5 influenza cases in Zephyr Hills. Akron General Hospital reporting on 25,000 flu cases treated homeopathically. Because Akron General Hospital used to be. So if you start reading the homeopathic treatment in epidemics, it's amazing. Cholera, polio, influenza, all of them. HIV, homeopathy has been successful. And there's something called the genus epidemicus. So when a major flu strikes, there's certain characteristic symptoms. That's one time where homeopathy, you don't have to individualize. A strong flu will overpower the vital force of everybody and give them the same symptoms. So there's usually a set of homeopathic remedies that will treat everybody. So I would encourage all of you to investigate homeopathy. Homeopathy was meant to be medicine of the people. The early pioneers had their homeopathic remedy kits. They traveled with them. I can tell you story after story with my kids raising them, how homeopathy. I remember my middle son, Ryan, fell off his bicycle, and he came in screaming and crying, could barely walk, barely holding his knee, wouldn't even let me look at it. And I'm going to run up and get the car keys, take him to the hospital for an x-ray. So I had some homeopathic arnica there, and I gave him some arnica, and I went up to get my car keys. He wasn't there. He was back on the bike riding. I says, Ryan, get back here. He says, no, Dad, I'm okay. I mean, the power is amazing. I had a personal experience. I was rushing, like I usually do, and was getting out of the shower, and I hit my toe on the ledge. I mean, really hard. Turned black and blue. It was swelling. It was throbbing. And I had to work that day, and I was in agony. And I said, arnica. Taking arnica, and no relief of pain. And that afternoon, I had a big golf match, and I'm golfing and in agony. I'm taking arnica, and I'm saying, well, homeopathy only works in certain situations, you know. But I went back home, and I picked up my homeopathic book, and I'm reading, and I came across hypericum for injuries of the small toes. I said, well, let's try hypericum. I took the hypericum, and instantly the pain went away. I went from barely able to walk to being able to jump up and down on my legs. So many people are introduced to homeopathy through treatment of acute problems. But if you're taking a constitutional remedy that I'm giving you, do not use any other homeopathic treatments. It'll interfere with it. Don't take arnica, don't treat your rash. You can take, and we'll talk about it in detail, you can take certain things, but do not do anything new. Don't take another homeopathic remedy, because I want to see how your body reacts. And we like using what we call LM potencies. This is something you take every day. There's different ways of prescribing a homeopathic remedy. There's centesimal, one dose, you wait 3 months. But there tends to be a reaction with that, initial reaction. And also you have to be careful. You can't use mint, and you have to avoid coffee, on and on and on. But the LMs you take every day, I don't want you to make major lifestyle changes. So I like the LMs for that. So what we're going to do is I'm going to take a break, and I'm going to start your IV. Then we'll talk about microcurrent.